Hello dear audience, welcome to another episode of Health Par Charcha. Today we will discuss about epilepsy, step-by-step guide on how to help someone having a seizure. Everything you need to know. For this we have with us Dr. Himani Pandey, Lab Head, Genomics Redcliffe Labs. We'll know more from her. Thank you so much, Doctor, for joining us. We would like to understand what are the different types of epileptic seizures.
So epileptic seizure, it's a common neurological conditions where there is a disturbance in the nerve cells activity of the brain, and this causing conversion or seizures and loss of consciousness along with the abnormal electrical activity in the brain. So epileptical seizures can be divided into two major groups. One is generalized seizure, another is focal seizures.
What are the long-term effects of this condition?
Yeah, so long-term effects may include cognitive decline or memory loss or like increased risk of the injuries and some major effect of the brain health. So these are the long-term effect in the epileptic seizures.
Ma'am, what is that one thing that a person near someone experiencing epileptic seizure should keep in mind?
Okay, if the person is having seizures, so we should know that how to help. Like sign or symptoms of the seizures are jerking, rhythmic jerking of the limbs, sudden fall, collapse and loss of consciousness. So we have to be very careful in these conditions. Like we should keep the safe of the individual. We should keep them away from the harmful and sharp objects so that they cannot harm themselves and to others. Also turn onto their sides to prevent the choking. We should not put any object or anything in the individual's mouth because it can lead or it can increase the risk of the injuries or the choking. We should cushion their head with the soft objects and also loosen their tight clothes. If the person is awake from the consciousness, so they may be confused, disoriented or exhausted. So we should calm politely, we should talk politely and also help them to regain the consciousness. And if the seizure is long lasting more than 5 minutes, so or they are unable to in the breathing, so we should call the emergency service and take to the person to the hospital.
Ma'am, how can that one individual experiencing seizures repetitively manage this condition?
So it can be managed through the anti-epileptic seizures drugs. Also neuromodulation therapies are there, dietary modifications required in these conditions. Some psychological and social supports needs in these conditions, and regular follow-up and modifications like monitoring through MRI and EEG. So this will be help to the patients.
I'm sure whatever you shared is going to be very helpful for our audience.